Hi, my name is Dr. Ahmed Khan, and I'd like to present an interesting case of cyclophosphamide-induced lung injury that presented to our hospital. This is a case of a 66-year-old male that presented to the emergency department with shortness of breath that started roughly 3 days prior to admission. He has a past medical history of interstitial lung disease, chronic kidney disease, and rheumatoid arthritis. Of note, 6 months prior, this patient was diagnosed with double-positive anti-GBM disease with anti-GBM IgG of 59.9 and a p-ANCA of 1.9. The patient also had a renal biopsy to confirm this diagnosis. Now fast forwarding to this admission, the patient had a CT chest that was performed that showed ground glass opacities and honeycomb appearing fibrotic changes. In the emergency department, this patient was started on BiPAP. However, when we came down to evaluate him, it seemed as though the patient's work of breathing was getting worse and his oxygenation remained in the 70s to 80%. He was immediately intubated and transferred to the intensive care unit. While the patient was in the intensive care unit, he was started on Solumedrol, and he was daily had an SAT and SPT until he was able to eventually be extubated. The patient's medications were restarted, including cyclophosphamide, which within a few days caused the patient to have increased work of breathing, and again, the patient became hypoxic in the 80s. The patient eventually required reintubation after restarting his cyclophosphamide. Though other possibilities were explored, including a echocardiogram and a CTA to rule out PE or pulmonary hypertension, it was very evident that the patient, once restarted on his cyclophosphamide, began to significantly clinically deteriorate. Discussing this case, pulmonary side effects of cyclophosphamide are considered incredibly rare. In fact, only less than 1% prevalence has been documented. Often patients will present roughly 5 to 6 months after treatment with worsening lung fibrosis, and there will be worsening shortness of breath and hypoxia. In the case that I present today, the patient was started roughly 5 to 6 months ago on his cyclophosphamide and presented with significant fibrotic changes of his lungs. Granted, we don't have initial CT scans of this patient. It is difficult to assess the extent of damage to his lungs throughout this 5 to 6 month period. Thank you very much for allowing me to present this case.